There are really three different kinds of skin cancers and a few much more rare kinds. There's basal cell cancer, squamous cancer of the skin, and melanoma. But most of them are very easily taken care of. I specialize in the treatment of melanoma, which is a more dangerous kind of skin cancer. Melanoma may often arise from a mole and often looks like a mole. It's a darkly pigmented area in the skin. And melanomas can be removed, and certainly are removed as part of their treatment, but they can spread into the body with more likelihood than the other skin cancers. So they often require treatments that involve the treatment of the whole body. The things you need to look for is any area on the skin that kind of persists and may bleed or itch. And that could be any kind of skin cancer. So they might be larger, they might be multicolored or black. Any mole that kind of changes, you have to worry could be a mole that's becoming a melanoma. Best thing we can do is detect these at an early stage. They can almost always be cured if they're removed when they're shallow, but if they're deeper, they may tend to get into the vessels and could spread. Particularly fair-skinned people, people with reddish hair, blonde hair, very fair skin, and people have a lot of sun exposure. Tanning is a big increase in the risk of skin cancer. It sort of doubles the chance of getting a melanoma, and if people can avoid tanning, their risk of melanoma is much less. The purpose of screening is always to detect a cancer at an early stage when it can be removed with minimal hardship and with a higher likelihood of cure. The most important avenue to screening, I think, is for people to have awareness of their own bodies, and if you have a changing mole, to bring it to the attention of their doctor or care provider. Probably it's reasonable to have your skin looked at every time you see your doctor for a general exam. The predominant treatment is surgery right in the beginning, and that may be all somebody needs. If it has spread to the lymph nodes, you may need other therapies as well. And we have recently had quite a bit of success with treatments to try to keep melanoma from coming back by stimulating the immune system or by taking medications that act directly against the melanoma. Many skin cancers can be treated and removed in a dermatologist's office if they're very small and very shallow. If they're melanomas, they almost always need a repeat excision of the margins to make sure they don't come back. A plastic surgeon can often do an excision that comes together quite nicely. They make certain they've removed the margins. They can do skin grafts if necessary. And in our practice, they can also look at the lymph nodes. At Minnesota Oncology, we have a good group of people who have expertise in treatment of aggressive skin cancer and melanoma. We have an outstanding plastic surgeon, Dr. Economo, who was really one of the first in the Twin Cities to develop the technique of looking at the lymph nodes at the same time the cancer is removed, which has become a very important and necessary part of the staging and initial treatment of melanomas. And we have a number of medical oncologists who have expertise in it. We have been able to treat people with research-based treatments, clinical trials of newer treatments, and so people had access to newer therapies long before they became available in the general community. And also in the Twin Cities, the dermatology community is very sophisticated and very thoughtful in trying to do the best treatment for their patients. We've been very pleased to work with our colleagues in dermatology. Avoid sun exposure if possible. Use of sunscreen and sun protective clothing if you're out in the sun for a prolonged period of time. The most important thing is just to be aware of your skin so that if you find something changing, don't ignore it, but bring it to the attention of your doctor or care provider.